Hey folks, how are you doing? Thank you so much for tuning in. My name is Dr. Debbie. I'm a mental health clinician and I'm board certified and licensed in the United States in the state of New York and Maryland. And I see all kind of varieties of mental health concerns. See children from the age of 6 to teens and young adults and as well as adults, for support as per mental health. But on this platform, on this my channel, is about education, about literacy, to support people about their emotional well-being, and that's for education, for awareness, for positive mental health. And we've been on a series about addiction, about drug addiction, about alcohol use, and how it can affect our mental health. And because on this channel we support positive mental health, and today we are going to be looking at the chemical aspect of addiction. And like when people take drugs, it's made of some aspect components which we will just look into briefly today, and the impact on our body, on our system, and on our health, and how it affects our mental health. Drugs are broken down in the liver into residues, which are, chemical compounds, and they are closely related to original substances. And most of these residues are eliminated rapidly from the bloodstream, and some can become trapped, in the fatty tissues of the body. Although there are various types of tissues that are high in fat content, and the one thing in common, to all these chemical processes and the problem that, the needs to be addressed, that these drugs reside or residues, they remain in the body, for many years. And tissues in our body that are high in fats, that they said, these drug residues that they get attached to, they are over the years slowly, and as they are turned over, the stored drug residues are released into the bloodstream and reactivate the same brain centers, just as if the person is just actually taking the drug as at that time, when that process, that chemical process take place. And then the former individual that has been using drug maybe becomes sober and said not going to use it again, maybe through support or whatever means, and they have a new experience, of what we refer to as drug re-stimulation, like a kind of flashback, and then the same cravings, that they were experiencing while they were on those illicit drugs or those heavy alcohol use, the same is being repeated, and the individual can fall into the temptation of craving again, or looking for the drugs or the alcohol, to be able to satisfy that craving. And this is common, in the months after an individual using drug or heavy alcohol, quits. And this can continue to even occur over years or decades. There are some people for many years, they they've received support or help, to be able to quit, illicit drug use or heavy alcohol use, but just out of the blue moon, this re-stimulation starts, and then they start craving for the same drug again. We experience that, I support people with addiction. I prescribe people, to help people with addiction. And we experience this, that many people will say, oh, that they've given up drugs, alcohol for some years, but they just relapse back. And the process is because of this that we have explained, this re-stimulation effect, and another one that we'll be talking about, in the next clip. And that is the reason why it is important, like you continue to be in touch, with your mental clinician, your therapy, or especially during time of episodes, situations, incident, overwhelming situations, and all that. Or like people that are trying to work out, they want to lose weight, especially since we said most of these chemicals of this illicit drug, they get stored in the fatty tissue. And during the process of losing weight, and like the turnover of that fatty tissue, it can reactivate that re-stimulation, of the drug use, and then the person gets back into it. And I've encountered many people that it was during that process that they can link it to, that they were working out, then they were trying to lose weight, and just suddenly, the urge came back again, the craving, and then they just slip back into drug use. So that is really important. Get all the help, all the support you need, and it is a long-term journey, that you continue to work, because all these things, they are physiological, and that is why we are creating this awareness, this literacy, that the best thing is, to stay out of drug, not to get in touch with it, because the process is a long term as well. Once it is started, you can get help and become sober and become clean, but because during that process, of quitting, the process is not ended in the system. The process is not ended in the fatty tissue that some of the drug residues, they get attached to, and over the years, then they can be reactivated again. And then we have the aspects of the brain aspect as well that we'll be diving into in a minute. So all those process, it's not that you quit, today or this period, and it is the person is done. It's a long-term journey, so you need to be continue touch, with your support program, and with your licensed practitioners, to be able to help you out. And then, yes, as I said, we talk about the cycle of quitting, like when people make up their mind, maybe because of the support, the education, or at times some people it's because of health challenges. Most of their organs start to react, and then their health is failing them, and then that prompts them into, like, oh, it's time to give up this, or maybe education, or maybe support system, like healthcare program that help people to walk with them through the journey of quitting. Or some people, like, yeah, and then with that as well, because of the withdrawal symptoms, that if they don't get the drug regularly, that we've talked about in my last video, that it makes people to get into crime because they want to get the drug by all means, and they are tired of that, or just because the cycle of relapse in and out, and those are how it starts, like quitting, then the withdrawal symptoms, then the craving, and the relapse, and it runs like a cycle. So drug is something that we are bringing this awareness, just like I said again and again, that it's a situation that is filled with so many faces. That is the best recommendation is not to get into drugs at all. Yeah, because quitting is not just the end of it, it has the other phases that can impact, yeah, the people's life, their functioning, their system, their health. And yeah, as I've said, that's the reason for this literacy, for this education, for people to know what it entails. So when an individual that has been using drugs of addiction, when they try to quit, to give it up, the cell of the brain is like a baby throwing tantrum, the brain cells, they've become so accustomed, so used, to this large amount of chemicals, and then they rely on them, their brain structures and the circuits, because it's addictive drugs, so the brain starts to throw tantrums, start to cry that no way, I need this, because of the large amounts. And then, so because of this, this forced the people, like, desiring the drug. Yeah, even though they want to stop, they want to reduce, and that is the phase when you are working with a mental health clinician. It's a thing that we do gradually. Like, in medications, in mental health, I always use the analysis of like an airplane. Even if you want to start any medication that, the art of prescribing, like a mental health, we just don't start, with maybe the dose that the individual we need. We start gradually because, of the brain, that is on the vital organ that I said, the most important organ that we have on human body. So, and it's the one that controls every other aspect of humans. So we don't want to overload or overwhelm, the system with any chemical, like medication, even those that are for health or for treatment. So we introduce it gradually. And if you want, to stop the medication, maybe we've achieved, the expected effect, the desire, or the overall outcome we want in the individual, also we prescribe, gradually. So during the time when people are trying to quit, it's a lot of things that are involved: the therapy, the support, and the medication. We carefully bring it down slowly. It's just like an airplane. When the airplane is getting out from the boarding gate, it's not just going to take off and be in the sky. No, it's gradually, taxing and then increasing the speed before it takes off and then become airborne. And the same thing when the airplane is landing, it's the same process. The captain is going to announce we're bringing our descent, to into this the into the city of New York, into the city of London. So it's a gradual process, and then the airplane starts, to descend. The same thing when any medication, and most importantly with this, because it impacts the brain, that those are the one we use, for support. We are careful. We are careful. We are intentional on the dose. Carefully, like we trick the brain that slowly, that the brain is not knowing that we are withdrawing something. Yeah, so we do it carefully. So, and that is why it is hard, for people to do it alone. You need the certified professionals, to work with you. So it is important, because if you don't do it carefully, gently, but slowly, the brain is going to react. It's going to throw tantrum, and the outcome is not always are very smooth. And that is when most of like people that are dependent on all these drugs, illicit drugs, or drugs of addiction, it's a kind of difficult time if they are walking that journey on their own, that they want to do like cold turkey, that they are not successful, and then they can easily get relapse back. So this system is called, drug craving. And then the craving is an extremely powerful urge, and can cause a person to create a kind of reason that they have to start using it again, because it's beyond their control. It's from the brain that is demanding, that is requesting, that needs to give them, this drug. And then they start the drug again, or they start drinking the alcohol again. And then, like I said, the trap is endless. It's like a cycle, and it continues, in the life of that individual. And quitting, it becomes an illusion. Yeah, so it's not advisable to do cold turkey. It's advisable to work with a certified mental health clinician, practitioner, and then they will help and to get you through the phases, or through the journey, that without experiencing relapse or any fear of withdrawal. And because we do it slowly, like the brain, eventually the brain cells will again become used to lower drug residues. Like if you work and with certified clinician, so the brain gets used to the low residue, because we are like kind of tricking the brain. And the slow the slow deep prescribing, and with all the therapy and all other program, all other services, psychologically, emotionally, that is involved, and the no judgment, of course, that is really important. And the empathy involved, help the individual, to adjust, and they are able to walk the journey smoothly. But otherwise, the deposit of drugs, so alcohol residues, release back into the bloodstream, those that have been stored in the fat tissue that I mentioned, for years. And then the cravings, the relapse remain, and that is really a cause for concern. And then the presence of these residues, even in microscopic amounts, can make the brain react as if the addict has just taken it. That is if they do cold turkey, and then the brain just reverts to that have been stored up in the fat tissue. And it's it just continue. And then the challenge of the person that is reliant on illicit drugs, on heavy alcohol use, is that their mental and physical craving for the drug caused by the residue that remain in the body becomes like said, a cycle, and then the biochemical personality caused by drugs and lifestyle of the person, they adopt to get them. Like I said, they are always very dishonest, they tell lies, they live in isolation and all that. And then without handling this, not seeking help, not seeking treatment, this can haunt somebody, for many years of their life, like they're living a kind of double life and make their life to decline. They're not able to make progress, economically, financially, in their career, in their relationship, in their family life. And this can be very frustrating. This can affect their productivity and even enjoying life, and it's really a difficult time. So if it is left untreated and unresolved, the symptoms, like we said, whether physical or mental, in origin, it creates an underlying, level of stress. Stress to getting the drugs all the time to meet, the demand of the brain, and then for 1,000 reasons, for people to continue to fall back into that cycle again and again. And like we've talked about causes of drug addiction and alcoholism. Like I said, no one wants to be a drug addict or using an heavy alcohol use, but this does not stop people from getting addicted, even though a lot of people, they know this route, they've had, maybe watch movie, had stories, or experienced a loved one, friend, family going through, the cycle of addiction, like the negative impact. They don't want to go into it, but unfortunately people still find themselves in this route. People still find themselves in this space of addiction. And we want to ask, most commonly asked question is simply, then how do people get into it, and why, if they even get into it even at all, because of maybe situations beyond their control, why can't they just stop? It's just because of all this phenomenon that we have explained, that once people get into illicit drugs and alcohol, heavy alcohol use, it becomes like a trap that people are hooked for a long time. And the first thing, we must understand about addiction is that alcohol and illicit drugs, they are addictive substances, and basically they are painkillers. That is physical pain and emotional pain. And when people are faced with one type of pain, be it emotional, be it physical, everyone, pain is unpleasant. People want like a kind of soothing item that can help them, to relieve that pain. And that is when some people, turn to drugs, as at that time, temporarily thinking to get them out of whatever pain, emotional, physical pain, psychological pain that they are going through. They chemically kill the physical and the emotional pain, and all because the components of this illicit drug and the alcohol, they alter the mind's perception of reality, and then people become numb, to their problem. Is that the problem is solved, for now, but unfortunately it's just like a kind of clouded situation. The effect of the drug or the alcohol soon wear off, and then the people pick their problem from where they are kept it. So it becomes a cycle. They want to soothe with the alcohol and illicit drugs. They get high, and then they forget the problem for a bit, and then they wake up again to pick the crumbs of the problem and the shackles of wheresoever they've left their problem, and continue in that cycle. So for drugs to be attractive to an individual, there must have been an underlying situation like unhappiness, sense of hopelessness, physical pain. And drug use and alcohol use, it increased a lot of life of people, causing risk of injury, violence, crime, even infection, HIV, hepatitis B infection, and a lot of other diseases. And especially in this world we are living now, there's a lot of unrest in many parts of the many nations of the world, and then the economic instability, poverty, people are not able to meet their daily basic needs, which push people into drug addiction. And it's very sorrowful, that people I have to go through that, in life, thinking, looking for a way out of whatever problem by creating a complex problem, for themselves. And that is why we are giving this literacy, this education, to educate people that that is not a really a good way out of problems. There are other positive channels, that people could sort or look for help. And then we are going to be discussing that, in the next video. I hope you learned something. My name is Dr. Debbie. I'm a mental health clinician. You can check my bio to learn more. And I hope you learned something. Share this video with people and with our young folks, some of them out of curiosity, peer pressure, or just sense of belonging. They are trapped into drug addiction or heavy alcohol use that can mess up their life. But there's always help available, and we're here. And I said I practice in the state of New York and Maryland, the United States, and I do this education literacy, just to save, the people, for them to be educated and to have overall wellness and positive mental health for everyone. All right, I hope you learned something, and until I see you in the next video, be safe and be good. Bye.